So thank you all for having me here. I understand that you spent the week talking about program evaluation. I'm going to transition a little bit to how those evaluations are used in benefit cost analysis and how in turn the benefit cost analysis is used to inform policy decisions. I thought I'd start off by just quickly going over this link between evaluation and policy, then talk a bit about the background for the benefit cost analysis framework, some of the underlying concepts, and then I'll talk in more detail about the components and steps in the analysis. In the slide deck that we will be giving you a copy of, there are some links to the guidance documents that we've written, as well as to some supporting papers which you can reference if you're interested. So program evaluation is really focused on trying to figure out whether or not a policy or a program or an intervention is effective and how effective it is, how big the effect is. Benefit cost analysis instead is trying to figure out which intervention should be implemented. You could have quite a few evaluations that show effects, but they may not be cost effective. But the other thing that happens is that policymakers are also often feeling pressure to make a decision in cases where nobody has done the formal evaluation. So that evaluation actually becomes part of the benefit cost analysis. Benefit cost analysis is usually conducted from an ex-ante or prospective perspective. In other words, we're trying to anticipate what would happen were the policy to be implemented. We can also do benefit cost analysis from ex-post perspective, a retrospective perspective, in which case we're trying to separate out the effects of what happened as a result of the policy and what would have happened without it. In other words, it's very similar to the approach for program evaluation, except that we're looking at economic impacts. This is a chart that shows the major components of a benefit cost analysis. I'm going to spend some time going through each of these steps a little bit later. But I thought that I'd put it up now because I wanted to emphasize the importance of everything that you've been learning in this course. I've done a gazillion of these analyses. I've reviewed probably another gazillion. And the thing that is the most difficult is the work that you're doing. It's predicting what would happen with and without the intervention. So the fact that you're taking this course puts you in a great position to do really excellent analyses. So what is benefit cost analysis? I suspect many of you have had at least some economics training and are familiar with a lot of different approaches for economic evaluation. There's cost effectiveness analysis, multi-criteria analysis, the list goes on and on. Benefit cost analysis is very well established and widely used, largely for interventions that are implemented outside of the healthcare system but have profound effects on health. Some of these interventions address the root causes of what might send you into a healthcare facility, a traffic accident, exposure to environmental contaminants. The advantage the benefit cost analysis has over many of these other frameworks is it uses the same metric, which happens to be money, to measure both harms and improvements. This makes it a lot easier to compare both the bad things and the good things that are going to happen if the policy is implemented. It also, as we'll discuss more in a moment, is based on the preferences of the people affected. So even if you don't use the results for decision-making or is only one of many things that you consider, understanding these effects can help you understand these preferences, can help you understand the degree to which people are going to be responsive to or uptake the policy. Many people, in thinking about economic evaluation of any type, whether it's benefit cost analysis, cost effectiveness analysis, multi-criteria analysis, really focus on the summary measure, the estimate of net benefits, the estimate of cost effectiveness. But I don't really think that that's the benefit of doing this sort of analysis. The benefit is actually very similar to the benefit of doing program evaluation. It encourages a systematic and thorough examination of impacts. It's not unusual to find that the policy will have impacts that you didn't anticipate. You learn more about the technology that's available, the costs and their effectiveness, who benefits and who receives the cost, which in turn will help you understand who's likely to support and who's likely to oppose the policy. It's very unusual to have benefit cost analysis or any other form of economic valuation be the sole source of a decision. Decision makers usually want to consider a lot of other effects. These might include legal requirements, they might include politics or government policy. There's the views of the stakeholders, the people who will be affected by the policy, the distribution of the costs and benefits, and we always have outcomes that are difficult to value: privacy, human dignity, all of those sorts of things need to be taken into consideration. I thought I'd show you some examples of places where benefit cost analysis is used, in part because these may be good resources if you're interested in learning more about completed analyses. The World Bank's website that's on your screen is a database of regulatory impact analyses. It lists documents that have been written by governments all around the world on how to think about the costs and benefits of regulations within a regulatory policy program. Benefit cost analysis is also frequently applied to social programs. That Pew MacArthur website is a program funded to look at state-level interventions in the US. They are doing a lot of meta-analysis to try and bring together the results of different evaluations. The book is one of several written by the Copenhagen Consensus, who uses benefit cost analysis to prioritize interventions. We're also seeing benefit cost analysis increasingly used in health. On one side of your screen, you can see the guidelines that we developed that I'll be talking about in more detail in a minute. But the Gates Foundation has been funding a lot of these analyses. We've had several Lancet commissions that have used benefit cost analysis to give insights into the magnitudes of different problems and how to solve them. So why do we do benefit cost analysis? Well, the whole idea here is to support decisions about how to allocate limited resources. We might be thinking about how to address a particular problem. For example, how to reduce the air pollution that's leading that woman to wear her mask. It might be used to compare policies that would be implemented within and outside of the healthcare system. How much would it cost to treat that woman for respiratory disease versus reduce the pollution that she's exposed to? It also helps us with policies that have both health and non-health consequences. Those kids who are in the classroom, that education that they're getting obviously has impacts on their earning capacity, but it also affects their health. So the bottom line here is that these approaches are very commonly used for policies that are implemented outside of the healthcare system that have very significant health effects. I'm going to move now to the conceptual framework. Those of you who've read anything about benefit cost analysis have probably seen this term used for all kinds of different things. We use it informally, just in conversation, to describe almost any process for weighing improvements and harms. However, within economics, it has a very precise meaning. It's rooted in welfare economics, and it reflects a specific normative framework. In other words, there is some assumptions about what counts and how to do valuation that underlie this work. The basic idea here is opportunity cost, the idea that anytime we use resources for one purpose, they're not available for other purposes. The fact that you are sitting here watching this video means that you can't use that time for other things. So there's an opportunity cost to watching me talk about these things. Within this conceptual framework, we base value on how much money the people who are affected by the policy are willing to pay or accept for the outcome. The assumption here is that people are the best judges of their own well-being, or at least the most legitimate judges. This is not a paternalistic framework. What we're trying to do here is to describe the extent to which individuals are willing, as members of society, to decrease how much they consume of other goods and services in order to achieve the policy outcomes. So a lot of people think that because benefit cost analysis uses money as a measure, what we care about is wealth, and that is not at all the case. Money is just a symbol of our willingness to trade off different goods and services. It represents the use of resources, labor, materials, that sort of thing, in order to achieve different policy outcomes. We could use another measure. We could compare those apples and oranges that are on the screen, just measuring everything in apples, 2 apples for 1 orange. The advantage of using money is that we do have market data that allows us to estimate people's willingness to trade off different things. Where we can, that means we can rely on market data. I don't know what the people who are shopping in that grocery store are trying to buy, but obviously if they pick something off of that shelf, the money that they've spent on that particular good, they can't spend on something else. Presumably the cost of that they're willing to pay for that item reflects the value that they place on it in comparison to the other things that they could use that money to buy. One problem we run into, though, is that there are some things that we care a lot about that aren't bought and sold in the market, health and longevity, environmental outcomes in particular. In these cases, we've developed 2 different methods that are used for valuation. One is stated preference methods. These are essentially surveys that ask people how much they'd be willing to pay for different outcomes. We also use revealed preference studies. What revealed preference studies do is they tease out the value of something that's not directly marketed from the value of another good and service. For example, our willingness to accept increased wages for a riskier job can be used to reveal the amount that we are willing to pay for the risk, or our willingness to pay for something like a bicycle helmet or another safety feature will show how much we are willing to pay to reduce the risk. One really important thing here is doing some thinking about what it is that you're actually going to include in your analysis. I'm sure you run into this problem all the time in program evaluation. It's an incredibly important piece. What we always suggest that analysts do is develop as comprehensive of a list as possible of the possible impacts, understanding that you'll probably add to that list or maybe even subtract from that list as you learn more about the policy. Then use screening analysis to try and figure out what's actually important. Screening analysis uses high-end or low-end assumptions to try and figure out, under very optimistic or very pessimistic scenarios, how important different things would be. One thing to be careful about here is that by important, we don't just mean things that have big effects on the results. We also want to make sure that we capture the things that people who are going to chime in about whether or not the policy should be implemented care about. For example, in air pollution policies, the biggest benefit is reduced mortality, but people find it really hard to think about changes in the risk of death. What they tend to focus on instead are things like respiratory effects, asthma, those sorts of things. So people who do environmental benefit cost analysis will often estimate the value of these impacts, even though it's a much smaller value than mortality risk. Once we do that screening analysis, we want to do more detailed analysis of the most important impacts where more work will help us reduce uncertainty, and report the results, including non-quantified effects and the uncertainties in our quantitative estimates. In that reporting, we can include the results of the screening analysis to say why we decided to focus or not focus on certain impacts. So I promised you we'd get back to this graphic. What I'm going to do is try to quickly march through each of these steps. In the guidance document that is linked at the end of this presentation, there's a substantially longer discussion of each of these pieces, but I wanted to at least give you a general sense of what's involved. One important thing is that we almost never go through these sequentially. It's just easier to display them as if they're a sequence. Usually what happens is as you work through each step of the analysis, you learn something new and have to go back and rethink some of the things that you've already done. As I said, assessing uncertainty and non-quantified effects is an important piece of every step in this analysis. In the guidance document, there is some discussion of how to assess that. I would imagine that this is an issue that you're also very familiar with from the program evaluation literature. But I'm not going to spend much time on that here. So the first step is, I hope, sort of obvious. You want to describe why it is you're doing the analysis. In some cases, there might be some very specific thing that you're trying to do: reduce air pollution, reduce traffic accidents, minimize the transmission of malaria. In other cases, it may be that you want to think about you're thinking about how to prioritize spending, maybe within a sector in terms of different types of environmental contamination, maybe across sectors in terms of traffic safety, healthcare, and other things. You might be interested in doing the analysis to inform a local decision, a regional decision, or maybe even an international one. The second step is where I think a lot of analyses run into problems. It's not unusual to see a benefit cost analysis that only looks at one option. And the problem is that then you don't know anything about the other ways that you could have solved that problem or the other alternatives that you might have ranked differently. So we want to make sure that whenever we do benefit cost analysis, we look at more than one option. We don't want to lead decision makers to ignore options that could be more cost beneficial. The third component in benefit cost analysis, we often talk about it as determining who has standing. That's a term from the legal system, which has to do with, in the legal system, who has the right to bring a case. In cost effectiveness analysis, it's often talked about as perspective. Are we going to do the analysis from the healthcare system perspective or a societal perspective? But the basic question there is whose benefits and costs can be counted. We may be interested in a certain geographic area, patients at a certain healthcare facility. There's many different levels of aggregation. We may also need to address preferences that might be considered immoral or unethical. How are we going to take into account the desires of criminals? It's possible to get hung up in really long discussions of this issue that are difficult to resolve. It's often easier just to take a very broad perspective, but then report the disaggregated results. That way people who are interested in how the definition of standing affects your results can look at the different levels of aggregation and think about the implications. Baseline conditions are the equivalent to thinking about what would happen without the intervention. The thing that makes this complicated in benefit cost analysis is that we need to predict what would happen over the time period that the intervention would likely to be implemented. And that's sometime in the future. So you might have a program evaluation that addressed conditions 5 years ago or even 1 year ago, but you're trying to think about an intervention that's not going to be implemented until next year, or maybe 5 years from now. And lots of things could change. Other policies could change, the economy could change, the condition of your healthcare system could change. So one thing that we want to do is try and think as realistically as we can about what would happen if we don't implement the intervention over the future time period. In retrospective analysis, I think the problem's a little bit more similar to what you're used to seeing in program evaluation. What we need to do then is try and tease out what happened because of the policy and what happened because of other factors. As I said earlier, predicting policy responses is by far the hardest piece of this analysis. So everything that you've been learning all week is really important here. What we want to do in benefit cost analysis is, though, to be as realistic as possible, taking into account how people react in the real world. This means that if you have an RTC or some other sort of a program evaluation that has been conducted under artificial conditions in a laboratory or in some setting doesn't mimic how people would react in the real world, you might need to think about making some adjustments. The other problem, as I mentioned earlier, is we often don't have formal evaluations, or the formal evaluations that we do have don't quite fit the context. Maybe they're done in a different area, a different time period, or slightly different intervention. In those cases, we need to think about how to synthesize the available literature, how to come up with some assumptions that are reasonable, and assess the uncertainty. We also need to be very careful not to attribute changes that would have occurred anyways to the policy, and also to make sure that we can explain the causal pathway. One problem in reviewing completed benefit cost analyses is they often don't use the same way to categorize costs and benefits. In a way, this doesn't matter because if your summary measures net benefits, it all balances out. But we also want to be able to compare total costs, total benefits, calculated benefit cost ratio. And in all those cases, how we categorize costs and benefits really matters. What we've done in the guidance document, and it has been also done in other contexts, is recommended that people use a framing that matches the lay people's understanding of these things, and think about it as a production process. So the costs are the policy inputs, the things that we need to do to implement the policy or the program. The benefits are the outcomes. If we use this approach, we need to be careful about how we deal with offsets. For example, let's say you have a policy, one piece of which allows people to automate a function that they wouldn't have been able to automate without this broader policy that you're implementing. Any savings that they get from that automation should be counted as offsets to the cost because they're part of the implementation of the policy. On the benefits side, we might have adverse outcomes. We might have infections after surgery, for example, and we want to count those as well as the beneficial results of the surgery. I'm not going to talk in great detail about how we estimate costs and benefits. The documents that are linked to this presentation have a lot more information on that, and there are several textbooks out there. But the bottom line is the cost we can usually estimate based on market prices because we also often know what the cost of the labor and materials that are used to implement the policy will be. Benefits are a little bit more complicated. Sometimes we have outcomes for which we have market values, increased agricultural yields, increased labor market earnings. But we often need to use the non-market valuation techniques they mentioned earlier when benefits include improved health and longevity or environmental quality or other things that are not often bought and sold. The final step in the analysis is to compare benefits to costs. If you look across these analyses, they use a lot of different summary measures: net benefits, benefits minus costs, benefit cost ratio, the benefits divided by the cost, the internal rate of return, which is the discount rate at which net benefits are zero. The important thing here is that we recommend that you report net benefits even if what you highlight as the result of your analysis is either the benefit cost ratio or the internal rate of return. The reason is that net benefits are much more sensitive to the scale or the size of the project. There's some examples of this in the guidelines. And the benefit cost ratio or the internal rate of return may change if the project gets larger or smaller. As I said earlier, we need to use consistent approaches to categorize impacts as benefits or costs. I'm not going to talk really at all about discounting, but it is an important piece of this framework. In this context, discounting doesn't mean that something is in some sense valued less. What it does mean is that we are weighting benefits and costs in terms of the time period in which they occur because we know that people prefer to get benefits sooner and to defer costs. We also know that if we invest our money or save our money, we can get a return on that investment, which we want to take into account. Distribution, who bears the cost, who receives the benefits, is often considered to be outside of the benefit cost analysis framework. However, every single guidance document, or at least almost every single guidance document that I've ever read, suggests that people also estimate this. Decision makers care a lot about whether poor people bear the cost and rich people benefit, or vice versa. And providing some information to inform that debate is really helpful. In the guidance document that we've written, we've suggested that at minimum the analysis should include some descriptive information on how net benefits, so both costs and benefits, are likely to be allocated across different income and other groups. So in conclusion, what are we trying to figure out here? Well, we know that there's always going to be uncertainty in our estimates. What we really want to do is provide some information on, for each individual policy, how likely it is that the benefits will exceed the costs and whether that exceedance will be large or small. For a group of policy, we want to provide some insights into how much that uncertainty affects the relative ranking. In some cases, it's amazing to me, you can have significant uncertainty in the parameters that go into the benefit cost analysis, but still find out that the policy has net benefits because the benefits are just so much higher than the costs. In other cases, you might not have so much uncertainty in your estimates, but the benefits and costs are very close to each other, and it'll be more difficult to determine whether or not a policy is cost beneficial. And one final point, even if you find out that a policy has net benefits or a favorable benefit cost ratio or internal rate of return, that doesn't mean you should just go ahead and implement it. We need to compare that policy to the other policies that could be implemented, including a policy of no action, to determine what the most efficient use of resources is. And as I said earlier, decision makers also need to consider issues such as political and legal constraints, as well as any distributional concerns. Thank you.